Good morning, everybody. My name's Anthony York, and I'm the founder and CEO of Boxing Futures. Boxing Futures is a small charity founded about 9 years ago now. We use boxing as therapy. So we use non-contact boxing to really engage with our communities. It's a conduit really for engagement. And we get our young people involved in various programs which aims to aid and abet and improve their mental health and physical well-being. I've got a couple of slides, and I just wanted to talk to you specifically about a program that we've been running for the last 7 years at least. We've been working in partnership, fortunately, with the Movember Foundation, who are a world's men's health charity. We specifically responded to a call to arms by the Movember Foundation called the Social Innovation Challenge. This was specifically to look at innovative ways to engage young men and boys into looking to address loneliness and isolation. So Brothers Through Boxing was a co-developed program specifically for them. So as I said, it's a worldwide call to arms for a Social Innovation Challenge where, again, I look for projects that were going to address loneliness and isolation, generally within the middle-aged sort of men population. I think the reason why Movember found us attractive because we actually focused on young people between the ages of 16 and 25, who again are quite a specific group that suffer from loneliness. So our identified population, again, were just young men between 16 and 25 who are struggling with their mental health, and we're finding it very difficult to find support, really. A lot of these guys were kind of three types of sort of young people that we were getting through our doors, really. One group, which would be quite surprising for you all, were ex-offenders. We had quite a lot of young ex-offenders that had moved out of their home area for reasons of, for the obvious reasons in terms of the criminality. So when they came out of prison, they were resettled into areas not known to them. So again, after these were typically young men who had exhausted most of their resources in terms of their friends and families and things like that. So they really did find themselves quite lonely and disconnected. A secondary group that we found to be really quite lonely were, of course, young Indigenous young people who, for whatever reason, just seemed to be misfits. More studious than probably the local community would like them to be, and they were quite sort of, for want of a better word, quite geeky, and they found themselves victims and targets of the communities. And then these young men struggled to leave the house. A lot of these young people ended up being homeschooled because of the bullying, and they just didn't really fit in, really. Again, a lot of these guys weren't very physically active either. So again, there was issues around obesity and weight, and which was aiding and abetting into their mental health. So a little bit about the structure of boxing, of Brothers Through Boxing. It's a 2-hour delivery every week, and it lasts for 6 months, 26 weeks. As you can see from the slide, the discussions are based around our social and emotional learning and learning. We use a toolkit called the Road to Resurgence, which is just a little playbook, really, which has got various challenging sort of topics which we sort of get into on a week-by-week basis. Some of these topics can be quite emotive, especially when you're talking about relationships and what causes them to be sort of lonely and isolated in the first place. So it's a very warm and it's a very interesting sort of group and dynamics when you get them together, really. Because, of course, first of all, when you get them in the room, all of them are only just there for the boxing, but deep down they kind of really know that they're there to sort of make friends, build social connections, which is one of the key drivers in terms of male suicide across the world. The lack of these social connections for men, especially in their middle ages, is one of the key things that the Movember Foundation specifically wanted to focus on in addressing, because the more social connections we have as men, the less likely we are to get into that state of mind where we want to, like I said, take our lives. So after we have the therapy session, the talking session, the workshop session, for want of a better word, it's really then great as we all get together and we train together. And we put the young men through their Bronze Boxercise Award, where they learn basic boxing punches, basic footwork, and things like that. But there's much more than what this program sounds, really, because the facilitators, the coaches, have to give so much of themselves, and part of that is giving up their time to take these young men on social trips and residentials. Some of these young men that we work with have never actually been on a meal out, for example, never sat around a table with a group of people and had a meal in that ways. Some of the other experiences that we give our young people in terms of community engagement and community volunteering. Also, a lot of our young men here that actually come back and volunteer on future programs, which is fantastic. But I said, this all happens within 6 weeks. Within 6 months. So it's a nice slow pace. I don't believe in these quick fix programs, 4 weeks, 12 weeks. I think they have value and a short impact. But if you want to change people's behaviour, change people's mindset, we feel that you need to work with people for a little bit longer. So it appeals to quite, like I said, a diverse range of young people. What's really important is that we've actually built in a counsellor as part of the programme and as part of the team. The young people that we're working with, they don't know that this person's a counsellor. They just see them as part of the team. But it's very important if we start opening up a can of worms, especially in terms of mental health and some of those deep down emotions and some of the reasons why they become homeless. It's very important that we keep an eye and we're able to sort of monitor each individual and just pick up on anything that we pick up on anything when we see that there may be vulnerabilities. What's quite amazing about this group, like I said, there's 3 different types of sort of young people that we generally get on our programs. Is how, to start with the alpha males, the guys that have been in prison, have come out of custody, a bit more jacked and laddish. Of course, they're the most assertive and loud at first, but over the weeks, the relationship really does change. Our young people that live in this country learn from the refugees and asylum seekers that have had terrible journeys to get here, and they sort of really get an understanding of what it's like to live a different type of life. Conversely, the asylum seekers learn a little bit more about the young people that live here, learn a bit more about British culture, and understand and actually are able to start to sort of mend themselves and try to look at some of the traumas that they have. One key thing for us is that we work in a trauma-informed way, which is very, very important in terms of some of the experiences that these people would have had as children and as young people. And as we are sort of developing these guys into young men, it's so important to try to build up the depth of social and emotional learning, and also just to build up their confidence. And all this is combined with physical activity. We've got a fantastic video I could show you if there's time at the end of the program. But these are some of the sort of results and surveys that we use. So, for example, the DSSI is a Duke Social Support Index, which again measures the levels of support that they think they're receiving. The UCLA, for example, measures loneliness and isolation, and the WebWebs measure, of course, which is the Warwick and Edinburgh Mental Health Wellbeing Survey, which measures levels of wellbeing and mental health. We're able to facilitate these programs at our gym. This is my team here at the bottom during our opening event last year. So we're actually upstairs, we've got facilities and classrooms and one-to-one rooms so that we can have those in-depth sort of quiet conversations. So we work with a variety of partners in the community, from Mind, from social services, youth justice services, probation services, community mental health teams, local authority. And so we have a vast a range of partners across our communities to really engage these young people and to gain the support. One of the things I would say about the Brothers Through Boxing program is that it's quite unique in its development in terms of it was co-designed by young people in the beginning with our staff, and that was a really key thing because young people are used to being talked at, told what to do, instructed, but it's much better relationship if we're able to work in partnership to really address their needs So the project was co-designed right from the very beginning. November were very brave in terms of the way they funded the development of these programs. And us were one of 13 projects worldwide across the USA, Canada, and Australia to actually progress and receive funding to pilot the programs fully. 5 years later, and several rounds of funding later, we're able to announce that we're able to scale up Brothers Through Boxing and move it out of Peterborough in the Cambridge area for where it was originally delivered. And this year we'll be branching out and delivering this program into London. So we're looking for new partners, and as well as existing partners, and anybody that feels they would have young people that could benefit from the program. It is aimed at young people about 16 to 25 years of age, and I've actually, because of the popularity of the program and the impressive outcomes, schools now have asked us whether we would develop the program to work with the younger age group of boys. That's Brothers Through Boxing in a nutshell. Like I said, it's not rocket science by any stretch. We use boxing as a conduit to engage with young people, but we really tap into their social and emotional learning and the development aspects during the 6-month program. I think that's it from me. I look forward to any questions that you may have at the end of the session, or if you want to throw them at me now, that's absolutely fine. Again, my name is Anthony York. I'm the CEO and founder of Boxing Futures, and we're a small charity that operates in London, Cambridge, and Peterborough.
Right, morning everybody. Really good to be here this morning to talk to you about Men's Pie Club. Chris is also on the call, Chris Smith, who coordinates Men's Pie Club on the ground. We are based in the northeast, and as Anne said before, we're also a Movember funded project. So we've received some incredible support from them over the last 5 years to get us where we are today. Okay, so Pie Club. Our strapline, very simple: local guys making pies. And our vision is very much focused on trying to establish really, good quality social connections. And basically, we use in-person, male-friendly, food-themed social groups, basically as an engagement tool to try and create really strong social networks. And we do that by running weekly pie clubs, and they're in a number of different venues. I think at the moment we've got 11 or 12 pie clubs in different communities in the northeast. We have up to 10 men at each club every week, and basically you come along to Pie Club and you make a pie, and you can see in the photograph there, just between the two guys at the front, the table on top of the table, that's where the magic happens. They're the mobile pie makers, which are ever so handy for Pie Club. But as you can see, and I love this photograph because it's just all of the guys mucking in, making a pie together, having conversations, making new mates, and it's a brilliant atmosphere within the clubs. Slightly different to Ant's program, Brothers Through Boxing. With Pie Club, it's literally a club, so there's no start or end week. It's kind of always there, come rain or shine. Pie Club is on every week in every venue, and it just gives the guys the ability to, dip in and out as they see fit. Obviously, would want to encourage kind of regular attendance, but there is that flexibility there, which I do think helps. And something else that's really important is that we have really good, safe, community-based venues that the Pie Men, our members, feel safe in, and I'll talk a little bit more about that later on in the presentation. Okay, our mantra, which I'm going to read out. Bear with me. Okay, the first rule of Men's Pie Club is we talk about Men's Pie Club, and we don't just talk about pies. We talk about loads of things that really matter and things that don't. It's somewhere to get stuff off your chest and put something in your belly. Men's Pie Club is for all kinds of guys, whether you're living alone or feeling alone, whether you're looking for mates or looking to learn. And this is something that we share quite widely with referral networks, obviously with members. It's and gives the guys an idea of the vibe of Men's Pie Club's vibe, basically. And we just wanted it to be, warm and welcoming. Again, I love this photograph. It's just all of the guys getting involved again. You can see the pie maker in the middle where the magic happens. But I guess the thing to emphasize here, and which for me, and I know Chris has said this a few times, I think it's just the range of backgrounds, life experiences, ages of the different members coming together that makes it really, really special. And we just think that this only improves the kind of supportive and respectful nature of each of the clubs. So that diverse range of backgrounds is really great. Okay, so universal recruitment strategy. So yeah, Men's Pie Club is for anyone. I mean, we do focus on older men compared to Ant's program. We kind of it's kind of aimed at guys in the middle ages, but if you're 18 plus, you can attend Pie Club, and it's pretty much 50-50 in terms of how members join. So it could be that a member sees a poster in a local community centre or supermarket, or they've seen us on social media, or just word of mouth, and they'll give us a ring and sign up and come along to a club. And then the other way that we get new members is through various referral pathways with loads of different community projects or healthcare services that are referring guys to us because they just feel that Men's Pie Club offers in terms of really trying to encourage those strong social connections, strong social networks, is just kind of right for their patients, if you like. So what has worked well? We're really chuffed with member recruitment and the continued demand. I think pretty much all of our clubs, apart from a couple that have just started, have got a waiting list, which is brilliant, really. So that's really given us confidence that we're doing something right, and that the guys are getting a lot out of Pie Club. And I think on that subject, by the way, we really do evaluate progress and just make sure that the service is doing what we want it to do. So surveys with the guys and just doing a bit of in-depth evaluation, so we can always continuously improve what we're doing. Second point there, community of volunteer leaders. I mean, again, Pie Club would not work without our volunteer leaders. We have at least one volunteer leader with each club, and they are really instrumental and making sure that it works, that it runs. So yeah, hats off to those guys. It's Men's Pie Club literally would not be here without them. Feeling the culture of the clubs, spoken a little bit about that already, but we try and keep it very chilled, fun, informal, and of course respectful. I was at a club last week in Fenham in the West End of Newcastle. It's in a community library there, and it was just probably two of the best hours I've had all month. Actually, it was just fantastic, really uplifting. It did me a load of good, I can tell you. It really was fantastic, and And the guys were just ever so good with me, because obviously don't know me particularly well. I don't go every week, but they were just absolute diamonds. Something else which is really important is great partnerships. We've got brilliant support from host venues, whether it be Fenham Community Library, community centres. We've even got a pie club, a men's pie club in a brewery tap room in Bishop Auckland, County Durham, which is very rural. And we've got a number of different relationships with referral organisations and wider stakeholders as well. So we do put a lot of time into building those relationships. And I guess one of the great things to see is that, you know, the socialising doesn't stop with Men's Pie Club. We're starting to see, you know, lots of members meeting outside of clubs in their own time and continually, you know, building their social networks, which, you know, is only having obviously having a really beneficial impact on their health and their mental health. So that's great to see also. Finally, again, like Anne said, we've got ambitions to scale the work that we're doing. Like I said before, we're in 11, 12 clubs at the moment, 120, 130 members. But over the next 3 years, we want to see if we can open 40 clubs. And that's going to be throughout the northeast of England, but we're also moving into Yorkshire as well, and hopefully working in Leeds in the near future. And so, yeah, just some fun numbers there, but that would involve us working with 80 volunteer leaders and having over 800 members, our brilliant pie men, and making a lot of pies in the process, 25,000 pies minimum. Just finally, you can just see some of the guys on the bottom of that slide there. They're some of our brilliant volunteer members. So Colin, for example, has been with us from day one, and Stuart as well, who was a bit of a star when Mary Berry came to see him, and a couple of the other guys to cover Pie Club. Again, these guys are just crucial. And that's our contact details. And again, looking forward to taking any questions, myself and Chris at the end.
I work for an organisation called Men's Craft. We have been around since 2007. We were formally legally set up in 2010. For most of that time, we have primarily operated as volunteers. And it's what I'm talking about here this morning really is no more than about 4 years old, in terms of a sense that men's well-being has become something that is much more topical, much more front and center, certainly at a local level. And I think it's fair to say the pandemic has played a part in that, in terms of recognition around higher levels of death rates within male population, etc., and vulnerability in the male population. But before I get into that, often people will say, Men's Craft, what's that about? Do you do knit and natter groups? And in some respects, we do some knit and natter groups, but we talk about crafting men and boys, really. So that's sort of a slight play on what Men's Craft is about. We have this strapline around happier, healthier men, making better friends, partners, etc. We look to make sort of positive difference through a number of interventions around men's health and well-being. We're active in trying to create constructive conversations about men, male psychologies and masculinity. And we're very, very much at a local level supporting other services and organisations in terms of their work with men. Please do have a look at this short film. It's 3 or 4 minutes long. We work across Norfolk and into Waveney, so we do sort of touch on parts of Cambridgeshire and into Suffolk as well, and very aware that those cross-boundary, cross-border services are quite crucial in terms of some of the men that we are supporting. Men's Craft works across a number of particular areas. I'm going to focus primarily on our suicide prevention program, but just by way of explanation as to what we're about. The exchange in the center of this slide is around support groups to men, so peer support groups providing mutual support. We have a number of activities that operate in the context of outdoor horticulture, garden maintenance and woodland programs. We're just embarking on a 3-year program called Dads on Side, which is around support to fathers, particularly fathers in adversity. So those who are in child welfare services maybe have lost access to their children. We've run a program, a Canadian-based accredited program from Canada called the Caring Dads Program, which is essentially working with men who are known for their harsh parenting, maybe on the radar of social services, children's services, and essentially as a 17-week behaviour change program for those at risk, so-called sort of perpetrators of domestic abuse, etc. So that's been something that we've been running for a number of years. Pit stop in the top left there, just sort of very much sort of echoing some of what was just said around the 2 previous presentations about engaging with men in sort of drop-in type activities, building friendships and connections, focusing on specific activities. And we have a whole range of activities that have been built up in line with what men are interested in. So fishing groups have become really quite a popular activity. We're doing creative arts, history walks, wood whittling, lawn tennis and table tennis, kung fu, carpentry, cooking, nutrition. So a whole host of different activities, primarily led by the men that we're working with. Critical sort of message to get across for us is about creating environments where men can thrive. So the sort of sense of a safe environment where trust can build up over time. A lot of the guys that we are working with are not going anywhere near mainstream services, are not in contact with their GPs and so on and so forth. So-called vulnerable and isolated men in a number of the neighbourhoods that we are operating in. The Pit Stop operates in 14 different neighbourhoods across the county. So we're quite keen to take what we have into local neighbourhoods, and creating the environment in which men feel safe is first and foremost the start of the work that we are doing. The Suicide Prevention Programme, it is funded by the Integrated Care Board in Norfolk, previously through Public Health. It is still managed by the Norfolk County Council. By way of scale, we are supporting around about 500 plus individuals on an annual basis, about 100 at any one time. One of the critical metrics within the service is making contact with individuals within 48 hours of them having been in touch with a professional or perhaps a self-referral, or we get a lot of third-party referrals from sort of sisters and wives and others who are concerned about their partners, etc. And critically, in terms of what we offer is getting in contact in a fairly immediate way, and getting alongside the individuals over a number of weeks. This is a sort of typical client journey. So within the 48 hours, we make contact. We go through quite a detailed conversation throughout. We're gauging the sort of the strength of the ideation, what's going on in terms of the triggers for the relationship breakdown, loss of job, possibly bereavement, life transitions and everything that goes with that. And a lot of what we do, it's non-clinical. It's very much just about getting alongside individuals and really tuning into where they are. We're not a crisis intervention service. There are other provisions available locally for for crisis, but we do work up to the high risk level. So working with individuals who are known to be sort of highly vulnerable, and it wouldn't take much for it to move into a crisis situation. Our referrals are coming from a whole range of organisations, social prescribers. We work in Norwich Prison, so we get a lot of work coming through the mental health team within the prison. We're clued into local delivery groups, primary care networks, and GPs. I recently got a call from someone who lives in United Arab Emirates, concerned about their friend who lives in South Norfolk. And with the consent of the individual, we were able to make contact and support that individual. The one that made my hairs on my back prick up a few weeks ago was when someone said to us that in 22 years of heightened anxiety and ideation, the work where he's been engaged with us it's the first thing that has materially changed his circumstances in 22 years. I thought that's a great quote, and would like to frame that and put that up, front and center to what we do. In terms of our outcomes, average age of those involved is around about 42. You'll see there, generally some very positive outcomes from what we are doing. Often, I think at the root of this is challenging self-limiting beliefs, and we do a lot of work in that regard through a host of other activities. I've mentioned the pit stop just to say a little bit more about pit stop, because it is an important part of the pathway for the suicide prevention program, which is about giving individuals sort of something to hook into, reason to get out of bed in the morning, getting involved. The added social value contributing to their local community, I think, is a really important aspect. And the emphasis here, I think, is also about bringing other services to men. So rather than an expectation that men go to find services, often what we're trying to do is bring services to the guys that we're working with. I'm conscious of time, so I won't spend too much time on this slide. We know these facts, but I think the aspect of friendships falling away and quiet desperation for surprisingly young men is something that we're very acutely aware of. That we're looking at sort of age, gender identity, race, ethnicity, and trying to address vulnerability in those terms as much as anything. Men in the public sphere, private sphere, this is a really important way in for us. This idea that we're addressing what's going on for men in both those spheres, and often where the hegemonic masculine identity is being challenged or is felt to be unsatisfactory, that's where a lot of issues around shame and complex difficulties kick in for men. And that's something that we're very keen to work with. This idea that, often men will sabotage in terms of money, relationships and work, etc. These are all things that we look to address in the work that we're doing. One thing I just wanted to end up, a couple more slides to finish, this sense of men and emotional literacy is something that we spend a lot of time working with. This idea that not finding words can lead to silence, and often silence over decades, and can be quite, this idea that men have a reduced emotional repertoire, emotional literacy, etc. And interestingly, there is an impact on service design. I would request that services are designed in ways that enable flexibility and creativity. We've had a lot of hits and misses in terms of what we've done. Some things work, some things don't. We need time to be able to work with that. Put funding in to work with men who are essentially unwell in terms of their behaviors and attitudes and so on, and to see it in the context of ill health as much as anything, I think is an important starting point. Mentioned already the move away from the reliance on self-disclosure and bringing services to men. and taking services to different demographics of men. So our challenge in the suicide prevention program is meeting the guy on the construction, self-trader, sole trader rather, working on the construction site, not likely to engage in 9 to 5 services. So how do we reach those sort of out of those hours? And engage with them on their terms. Last thing, really, just to say is promoting what it means to be a good guy, what it means to be a good bloke, a good lad, and sort of that sort of promotion of what the vision for positive masculinity looks like is also something I would emphasise as something we are keen and central to what we do.